Hello, and welcome to Ed Talks. My name is Edwin Perez. I'm an anesthesiologist and a pain management physician. I work out of Newark, New Jersey. So I'm not fancy like Dr. Oz or Dr. Phil or any of these guys. And the reason I'm making these videos is because I'm asked to explain my position on various subjects over and over and over again to both my patients and students and all sundry types of people at my hospital. And so I figure maybe if I just make a video, I won't have to keep explaining myself over and over again. Maybe I can just refer people to go watch the video, and I can move on to doing something more important with my time. So, with that having said, welcome to Ed Talks. So, the first topic that I'm going to tackle today, is going to be my position on medicinal marijuana. And again, this is my personal position on it. You can take it or leave it or throw it away, do whatever you want with it. But this is what I think. So, the question here is not about whether medicinal marijuana has a role. I think that that is a misleading question and is not actually the question we should be asking ourselves. The real question we should be asking ourselves is, should this drug be for medicinal or recreational purposes? All right. So should we use this drug for just medicinal or recreational purposes? And I think that is the real question that we're actually trying to answer here. So basically, I'm going to give you what proponents of medicinal marijuana state. Okay. They say that number one, it's helpful with pain. Congratulations. Many things are helpful with pain. As a matter of fact, the literature is replete with things that are helpful with pain. As a matter of fact, almost everything helps with pain in the short term. The literature finds that practically everything, including saline, works for pain for a while. Okay, so great, it helps with pain. Lots of things help with pain. I'm not swayed by it at all. It is very helpful in HIV neuropathy. It is very helpful in multiple sclerosis, but so are a million other things. And guess what? We consume about 93% of the world's opioid productions given to our population to help with their pain, and our pain scores are certainly no better nor worse than any other country. So, great, it helps with pain. Proponents of medicinal marijuana state that it helps with nausea. Great, helps with nausea, wonderful. It'll be a cheap drug, it'll be helpful for nausea, okay. And then the other thing that proponents of medicinal marijuana state is that it basically is a cure-all. I mean, it's going to cure this, it's going to cure that, you're going to feel this, you're going to feel that. It is the best thing on the planet. Which, of course, is not true. Nothing will ever be a cure-all. But certainly, there is a role for marijuana in medicine. I'm not going to doubt that. Now let's talk about recreational marijuana. What do the proponents say? The proponents say basically that, well, it's not as bad for you as tobacco, which is true. They say it's certainly no worse than alcohol addiction. It's true. They say that marijuana isn't necessarily going to lead you to anything else. I mean, you're not going to turn into a hooker just because you do a little marijuana. It's true. And also, this drug war. I mean, think about it. Think about it for just 1 second. There are people dying, losing their lives over marijuana. Personally, it doesn't seem worth it. I mean, people are dying in gunfights, knife fights. They're getting hit with blow darts, okay, because of marijuana. Is it worth it? We really need to ask ourselves this question. What are we accomplishing by making it illegal? What are we so scared of that we can't handle? So those are two sides of the coin here. Now, what do I think? Which is really what this video is about, because at the end of the day, it's called Ed Talks. So the medicinal value is okay. And I think if we want to create medicinal marijuana, that's fine. But I also believe that it should be allowed to be used recreationally. And I'll give you an example. Tylenol is over the counter. So are some NSAIDs, okay? You can buy them and use them at your discretion for really whatever purpose you want, medicinal or not, okay? And marijuana should fall more or less in the same category. And this is why. If we make marijuana legal only for medicinal purposes, you're going to get 3 types of patients. 3. You ready for the 3 types? Type number 1 is the patient that actually could benefit from it. Wonderful. Type 2 is the patient who will self-induce a make-believe pain state in order to show to the doctor that they should get medicinal marijuana. We don't want those kinds of patients, because those types of patients cheapen the experience. And what it makes physicians and healthcare providers do is doubt the real people who have real pain. Sort of as if you cry wolf too many times. So we don't want those patients. We don't want to create that type of patient. We already have that problem with patients coming in for opioids. We don't want to have it again with marijuana. And then there's a third patient, and that is the patient who unknowingly creates a true pain condition in themselves in order to obtain marijuana. Now, I know what you're thinking. You're saying it is impossible for a person to self-induce a pain state. I beg to differ. I'll give you an example. Have you ever heard someone say, "Stop it, you are making my headache worse"? Now, I'll tell you 2 things, actually a couple things, actually not keeping count of it. The person who says that, "You are making my headache worse," we can make several facts, or we can make several notes about them. Number 1, they probably really do have a headache. And number 2, you are probably truly making their headache worse. We call this the biopsychosocial model of pain. We've done away with just the medical definitions of pain, okay? We know that pain is here as well as in the physical body. So we can control a lot of the sensations that run through our body, both pain and otherwise. And so there may be a person out there, and I'm sure that there will be a person out there, who will induce a pain state in themselves in order to obtain medicinal marijuana, if that is the only way that they can get marijuana to use for not pain, but for some other underlying issue, emotional or otherwise, that they are suffering from. Because pain, what is suffering? It is a combination of the physical problem going on along with the suffering that is going on. And that third type of patient is the type of person I would rather we not create by just allowing marijuana to be used medicinally. Does that make sense? I hope it does. So, in short, my position is, if we're going to make it legal, it should be legal, period, end of story, for everything. And if we're going to make it illegal, we should make it illegal, period, end the story for everything. However, I don't think that one is going to work out. So we might as well go in the other direction. Well, thank you for joining me for Ed Talks, and hopefully this will allow me to shuttle people to these videos as opposed to having to repeat myself over and over again in the hospital. So thank you for listening to my rambles, and remember, when Ed talks, please listen. Take care.